Welcome to our video on how to reduce the cost of emergency wisdom tooth removal. If you think your wisdom teeth may be impacted, you should seek emergency wisdom tooth removal from a reputable oral maxillofacial surgeon or an experienced emergency dentist. You cannot wait until a normal visit to the dentist or call a specialist to find out how your condition is progressing. Call an emergency dentist today to get your wisdom teeth removed immediately. Listed below are some important tips to remember before scheduling a surgery. To find a dentist who is experienced in emergency wisdom tooth extraction, follow these tips. Pain from impacted wisdom teeth. In a condition where impacted wisdom teeth are not able to grow properly, they are located in the jawbone and live inside of a follicle. When the follicle becomes impacted, the teeth will fill with a pus-like fluid. This fluid can become infected, grow in size, and even develop into a cyst. If not treated, the cyst can weaken the jaw and develop into a benign tumor. Depending on its size, surgical removal of the impacted wisdom teeth may be required. During an extraction, the dentist makes a small incision in the gum line. Next, the tooth is loosened with a dental tool, applying pressure on the tooth and gum area. The entire process may take 20 minutes or an hour, but it is not a pleasant experience. A dental appointment to remove the impacted wisdom tooth can be uncomfortable. If the impacted tooth is causing pain, an oral surgeon may recommend a surgical procedure to remove it. While there is no one specific treatment for impacted wisdom teeth, there are some things you can do to relieve the pain and prevent it from becoming worse. If you are experiencing pain and you are concerned that it is caused by wisdom teeth, it is important to see a dentist as soon as possible. Sometimes, you may not feel any pain, and it could be the result of gum disease or tooth decay. A dentist will determine which of these treatments will be most effective. Infected wisdom teeth are more likely to develop an infection. The bacteria can get trapped in the flap or pocket that covers the impacted teeth. This can lead to pericoronitis, an infection of the tissues around the third molars. In more severe cases, the infection can cause pus-filled abscesses or cysts. In addition, if not treated, the impacted tooth may damage the jawbone and nerves. Complications. Emerging in the late teen or early 20s, wisdom teeth can cause a wide variety of complications. Because they are so far back in the mouth, they are difficult to clean and can cause gum disease and severe tooth decay. In addition, they can become lodged under the gum line, causing intense pain and increasing the risk of infection. If left untreated, wisdom teeth can cause infection and other problems. Other possible complications of emergency wisdom tooth extraction include infection, which can develop anywhere in the body. When impacted, gum tissue can become swollen or infected, resulting in pain or bad breath. Bleeding gums can also indicate bacterial infection. Infections around the wisdom teeth can damage neighboring teeth, jawbone, and tissues. Eventually, they may cause painful cysts, and even require emergency extraction. After surgery, you'll need to rest. After the extraction, you'll be prescribed painkillers to ease your discomfort. In addition to taking a painkiller, you should avoid spitting, smoking, or sucking for 24 hours. This will prolong the healing process, and the bleeding could lead to a dry socket. Anti-inflammatory medications and ice packs can help prevent any bleeding after surgery. To minimize swelling, prop your head up with a pillow to keep your head elevated. While the procedure doesn't have to be painful, it can be uncomfortable, and a dentist will assess the condition and recommend the best sedation. It's important to get the sedation right so that you won't have to worry about discomfort after the procedure. Your oral surgeon will also give you post-operative instructions that you can follow to ensure that you're as comfortable as possible. You'll need to have some time to heal after your emergency wisdom tooth removal. Cost. If you have a toothache, the cost of emergency wisdom teeth extraction may be a huge concern for you. Even if you have dental insurance, this may not cover the entire cost of the procedure. Some policies cover only emergency wisdom tooth removal, so you must be prepared to pay the full amount yourself. You can, however, plan ahead by taking a look at your finances to avoid any emergencies. Listed below are some ways to reduce the cost of emergency wisdom tooth removal. If you don't have dental insurance, there are several ways to cover the cost of this procedure. First, you can contact your insurance provider to see if they cover this type of procedure. In some cases, they will cover the procedure if it's deemed medically necessary. Second, you should consider the geographic location of the dentist's office. Emergency dentists often charge more than regular dentists for the same procedure. In addition to location, you should consider your cost of living. Large cities and coasts generally have higher prices than the rest of the country. Having dental insurance also reduces the costs. This type of dental treatment can be very expensive, so you should consider this carefully before booking it. Third, consider your insurance provider's coverage before deciding which service to choose. Most insurance plans cap the cost of wisdom tooth extraction at $1,500. You may also need to pay extra if you want general anesthesia or nitrous oxide. Having general anesthesia can add another $100 to the total. Otherwise, you may have to pay as much as $720 out of pocket for the entire procedure. In some areas, the cost could be as much as $2,730. Sedation options. There are several sedation options for emergency wisdom tooth removal, and they all work differently on different patients. The choice of sedation will depend on the patient and the complexity of the procedure. Generally, the lowest amount of sedation is appropriate for short procedures, while people with high anxiety and low pain tolerance may benefit from more intense sedation. The lowest level of sedation can reduce anxiety levels and pain, but the patient will likely remember nothing of the experience once the medication wears off. Local anesthesia is usually enough for most oral surgical procedures, but if a sedative is needed, you can also choose to use nitrous oxide, also known as laughing gas. This type of sedation is a popular option for an emergency wisdom tooth removal. This gas acts as both a sedative and an analgesic. Regardless of the type of sedation you choose, it is important to discuss the options with your dentist. In addition to nitrous oxide, there are other sedative options for an emergency wisdom tooth removal. In addition to the oral sedative, you can opt for N4 in your body. This type of sedation is often used for multiple dental procedures. However, it does have some risks. The risk of sedative overdose is very high. If you are not in a sedative-tolerant state, you may need to take a nap before your dental procedure. 4 sedation is the most effective type of conscious sedation. It reduces the patient's awareness and reduces anxiety during the procedure. Although the patient is technically awake, they will not remember much of the process. Patients who undergo 4 sedation report being asleep during the entire procedure. These medications are controlled and predictable, but they will require an escort home. A fast is also required before this type of sedation. Signs and symptoms of an emergency wisdom tooth extraction. When it comes to dental problems, bleeding gums after an emergency wisdom tooth extraction is one of the most common symptoms. This may indicate an infection or excessive bacteria. Bleeding gums can also be an indication that underlying periodontal disease is present. Inflamed gums should be treated with NSAIDs to alleviate discomfort. When bleeding gums persist for longer than expected, seek immediate dental attention. If your gums swell, your wisdom teeth may be causing pain. This irritation is usually caused by the partially erupted wisdom teeth. The gums may also be irritated from the pressure of chewing and could develop into an infection. This condition will not improve without immediate wisdom tooth removal. If you suspect that you need an emergency wisdom tooth extraction, seek immediate dental treatment. These signs and symptoms could signal that a bacterial infection is the cause of the pain. While many people opt to have their wisdom teeth removed in an effort to avoid pain, the procedure may be a good idea in some situations. Wisdom teeth are often forgotten, and as such, they may become partially trapped under the gum line or even press against other teeth. This can lead to severe pain and inflammation. If you notice any of these signs or symptoms, it is probably time to see a dentist. You should make an appointment as soon as possible if the pain becomes too severe to deal with on your own. Post-operative care is important after an emergency wisdom tooth extraction. Taking antibiotics is recommended to avoid infection and ensure that your mouth remains clean after the procedure. Also, try to avoid hard food and apply ice to the outside of your mouth. Only your dentist can determine whether you need to have your wisdom tooth removed. You should never ignore the signs or symptoms of tooth extraction. You may be suffering from pain or infection, but the process is still necessary to keep your mouth healthy. Thanks for watching. Please like, comment, and subscribe for more.